Planning pregnancy or finding out that you're pregnant is a really exciting time, but it also means that it's a time where you're provided with lots of information, and that can be a challenge. Here at County Durham and Darlington, our team of community midwives and obstetric team support staff are all here to be able to provide you with the information so that you can make the choices which are best suited to your pregnancy journey and pathway and personalised to you.
There's no stage too early to think about where you want to have your birth. It is dependent on risk in some situations, so that may well depict where you go. However, talk to us. We're here to provide you the information. You can make choices that are informed, that relate to your clinical situation, and enable us to provide the right care in the right place for you.
It's really important that you have a look at what options are available in the units that you're surrounded by. There's lots of choice, but your midwife is there to be able to talk to your obstetric team, making sure that you can get booked into the appropriate hospital or birthing unit for you at the appropriate time is really important.
On arrival here, you will make your way through the double doors. There is a buzzer there that you'd have to buzz, and that gets you through to our reception staff, and they are the first friendly faces that you'll see on arrival. They will direct you to where you need to be from there, depending on whether you've come for an appointment or if you're in labour. The nice big rooms, we have all the equipment that we need to look after you and your baby. We have lots of different lighting to make you feel nice and relaxed and settled here. We have a lovely pool birthing room as well that you can use if you wish to. All the rooms here on our labour ward are private rooms, so you can do with them whatever you want to make you feel comfortable. You can bring things in if you want to individualise your room, personalise your care, whatever it is that makes you feel safe and comfortable. And we have en-suites in every room as well, which is always a bonus.
So as you arrive at Darlington Memorial Hospital, come in the main entrance, walk down the corridor, straight ahead of you. At the bottom of the corridor is the lift to the 6th floor. And that's where you await your lift to take you up to the penthouse, which is our maternity unit. We're all on one floor like one big family. Neonates, maternity, triage, and we'll be here waiting for you. We've got some really fantastic low-risk rooms with birthing pads and lights, which lead into a birthing pool. The birthing pool's also got some really lovely lights in the ceiling.
Who is present at your birth will depend on your individual circumstances. Sometimes it will just be you, your birth partner and one midwife. Sometimes there can be a couple of midwives. We do sometimes need doctors to be in the room with us, obstetricians, sometimes paediatricians. It just very much depends. If we do need that, we'll be communicating that to you and you'd be informed. After labour, you will get the famous tea and toast. It's always the best tea and toast that anyone's ever had. You can also feel free to bring any snacks in that you want to, and you can have those, throughout your labour.
So when we're thinking about your pain relief options during your pregnancy, this would be a conversation that we should have with you as the medical team, along with your community midwives and when you come into hospital. If we do need added pain relief, we've got Entonox, which is gas and air that can be taken as you need it. We've got injections called pethidine, which can be given throughout the labour. If you need a more continuous level or a higher degree, then we would get our anaesthetic team to see you and maybe think about an epidural. If we need to go to theatre for that next level of care, being a caesarean section or maybe an instrumental delivery, we would need possibly a spinal anaesthetic that just gives us a more dense pain relief so that you don't feel anything. But we would want to have that continuous conversation with you so that you feel comfortable in all the options. Sometimes people may choose to have a planned delivery in theatre via a caesarean section, in which case we have lots of discussions around that and would give a planned date and time. Other times emergencies may arise during your labour. If you did need to go to theatre, we've got a selected team that's dedicated to you. We would try and inform you of all the aspects of why we're doing it and in what time frame, along with your birthing partner and your family that are present as well. We really want to support you and have the birth experience that you and your family want. At the end of the day, we really want a happy and healthy mum and baby and family, and we would do everything we can to support that.
think it's normal to feel nervous. You're about to embark on this journey that is so special, but it's also life-changing as well. Just honestly take it every moment. It is the absolute greatest thing that you're ever going to do. And if you need to, just ask questions. That's what we're here for. We're here to support you. We're here to answer any of your questions. So just ask us and we'll hopefully put you at ease. So I had my 3 children here. It was the most amazing experience ever, and I would never have wanted to do it anywhere else. And if that's not a sign of approval, I don't know what is.